Dr. Ashley Butler talks about the intersection of race and ethnicity and the prevalence of diabetes and childhood obesity. She further explores social determinants of health and the impact of childhood obesity. She explains implicit bias, how it exacerbates existing health disparities, and discusses upstream factors and policies that impact health.
Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish Podcast. Yumlish is working to empower you to take charge of your health through diet and exercise and reduce the risk of chronic conditions like type 2 diabetes and heart disease. We hope to share a unique perspective and a culturally relevant approach to managing these chronic conditions with you each week.
Dr. Ashley Butler is a fellowship-trained associate professor in the Department of Pediatrics section of psychology at Baylor College of Medicine and serves as a licensed psychologist at Texas Children's Hospital. Welcome, Dr. Butler.
Thank you.
Dr. Butler, diving in, what drew you to the field of psychology and pediatric health disparities research?
Well, I was drawn to the field of psychology actually as a high schooler in the 11th grade. I remember one of our assignments was to actually research various career potential options that we might be interested in. And so I, at the time, chose to look into mental health careers, both psychiatry and psychology. And actually, in my high school graduation, they have little books where you write out what your career goals are, what you want to do, how much money you want to make, where you want to live. And I actually wrote psychologist down in that book that I still have. But I wanted to be a psychologist, but really didn't know exactly what I would be doing in the field of psychology. But probably there are two major experiences that I had that really guided me to focusing on health disparities, in particular for racial and ethnic minority groups and socioeconomically disadvantaged families. One being when I was an undergraduate student in psychology in New Orleans, I had the opportunity to volunteer with one of my professors there and actually working at the VA. And he was doing a lot of therapy, researching various therapy techniques for patients at the Veterans Hospital there, and just really became aware that certain groups, more vulnerable or marginalized groups, are not have a lot of barriers to accessing mental health services in particular. So I became, interested there, but, through some other experiences, really wanted to work with children and families. And as a postdoctoral fellow here at Baylor back in 2010 and 2011, just really delving into the research and seeing the very significant disparities in health outcomes. So thinking about, children, minority children with certain chronic conditions are more likely to die from those chronic conditions. Their families are more likely to have a lot of burden from those conditions. And so I really became interested, back then with just seeing the heavy information about the numbers with regard to death and burden with certain chronic conditions, and really I set my sights out on focusing on research in that area.
And speaking of chronic conditions, a lot of work that we're doing is in diabetes over at Yumlish. Tell us about how do race and ethnicity really impact the onset and management of type 1 and type 2 diabetes in youth?
So really race and ethnicity have somewhat of a different relationship with type 1 and type 2 diabetes. So they're really kind of, you could think of them differently. So in particular for type 1, we know that individuals with type 1 diabetes are racially and ethnically diverse. But there are differences with regard to the management of type 1 across race and ethnicity, as well as health outcomes. So we know that African American and Latinx children and individuals with type 1 diabetes in particular are less likely to have the advanced technologies for diabetes management, such as continuous glucose monitors or insulin pumps. And we also know that health outcomes tend to be worse for African American and Latinx individuals with type 1 diabetes. For type 2 diabetes, it's a little bit different, where we know that there are racial and ethnic differences in the onset of diabetes or who gets type 2 diabetes. We know that individuals of color, Native Americans, African Americans, Latinx individuals are more likely to, they're overrepresented among individuals who have type 2 diabetes. And then there are some differences with regard to health outcomes as well that are similar to type 1 diabetes. So, for example, having more significant complications later on in the disease course, such as amputations, we know that there are more likely to have those as well.
Let's talk about childhood obesity for a moment. How do social determinants of health really impact childhood obesity?
So, social determinants, there's a lot of talk about social determinants these days, a lot of different definitions. But, I think of social determinants of health as sort of those things that are within an individual's environment, the way that the things, the places where they are living on a regular basis, where they're working for children, where they are playing on a regular basis. It's kind of those things you think of outside of, the traditional healthcare setting or their medical appointments. And we know that there are differences in terms of social environments. So, for example, we know that individuals living in communities where there's less access to healthy foods, there's less grocery stores, more options for things like fast food and less healthy food options. We know that that associated with higher rates of overweight and obesity. Also, things just such as the sort of walkability of a neighborhood or safety of a neighborhood that relates to more ease of physical activity. We know that when communities have fewer of those options, that's also related to childhood obesity. So there are these things within an individual's social environment that could impact the onset of childhood obesity.
What is the role of implicit biases in exacerbating these disparities?
So implicit biases, there's also a lot of talk about implicit biases these days. And so really, when you think about it, the definition is really in having a preference for or against one thing or someone or something like racial ethnic group, for example, or preferences for or against socioeconomic status of an individual. And so biases really can be positive or negative, but when we think about disparities, it's really when there's a negative bias against a racial or ethnic group or a socioeconomic group. So, for example, biases among we know there's a lot of evidence that tells us that there is bias against African Americans among healthcare providers that really occurs. A lot of times people say, oh, healthcare providers, they are, in this profession, they're good people, they care about others, they're really in a helping role, right? So there's a lot of like, well, no, they don't have implicit biases, but we know the studies show that healthcare providers actually have levels of implicit bias against African Americans, for example, that are at the same rate as everybody else in our country. And so, even when those biases are occurring outside of a person's awareness, so they don't know that these things are happening, the biases really can lead to poor communication between patients and providers, where providers may tend to dominate the conversation, they share less information in the encounter with an individual with diabetes, for example. And they actually, the other piece is more emotional, where they actually may show less empathy towards an African American patient. And then, what ends up happening is patients are less satisfied with their care. And we know that satisfaction, having strong relationship with provider, trust in provider is going to be important for patients to continue in their care, to follow recommendations that are being provided. And also it's important because patients need to provide their healthcare provider with information too, so that treatments can be adjusted based on the family's circumstance. We know that because implicit bias affects communications, there's poor communication that happens. That's where the breakdown occurs and could exacerbate the disparities.
So I got a loaded question for you. What is really being done, and what else can be done to mitigate these health disparities?
So I think that there's several things. One, some organizations really are embarking on ways to target social determinants of health and implicit bias. There are organizations where they're delivering training to their providers to increase awareness. Just a lot, like I said, a lot of times the thought is, well, implicit bias isn't happening and it's not affecting me, or not impacting my patients. So there's training to increase awareness of just how the brain works, and that there's people, a lot of times people say if you have a brain you have bias, right? So it's increasing awareness, and then also teaching mitigation strategies. So what are things that organizations could do to better standardize care to help reduce potential biases that may be happening, just to also deliver ongoing assessment to look at places in care where there may actually be vulnerability to implicit biases playing out. So like I mentioned, with regard to differences in terms of technology being prescribed to certain groups, being able to really know if that's happening, there needs to be really good assessment happening within organizations. So organizations, I think, are doing those kinds of mitigation techniques for implicit bias. And then with regard to social determinants of health, there's some data in more general pediatric settings, not necessarily in diabetes, but where you could actually screen folks for social determinants of health that may be impacting diabetes management, where you can ask them questions such as, are you having difficulty keeping food at home? Are you running out of money before you have money to buy more? And in the healthcare setting, you could ask patients that and then help better understand if social determinants is something that's impacting management, and then, adjust, either doing things like connecting them to community resources to help reduce the impact of that particular social factor on a health outcome or on management. But also sometimes, asking about that can help providers tailor or adjust the treatment regimen that may be helpful as well. So there are, I think, different strategies that organizations may take to targeting social determinants. And then I think there is some there from an organizational or policy perspective. There are also new incentives, for example, through Medicaid, where there's some possibility for organizations or for patients to be able to access certain social resources because social resources is something that's impacting their health. So, for example, insurance can be used, for example, for if a health plan decides that grocery delivery is something, if a person lives in what they call a food desert, there's not access to healthy foods that they can easily get, the health insurance could be used to cover a grocery delivery to a family with diabetes, for example. And then also, there are also one of the challenges in healthcare settings is, of course, when you think about social determinants, healthcare providers are really trained to, provide medical treatment, right? They may not have had a lot of training with regard to identifying social needs, and then even if they do uncover that, what are they going to do about it? And so that takes time to be able to talk to families about that, determine what social determinants might be impacting diabetes management. That's really complex when that starts to happen. So there are also incentives being rolled out where providers can actually account for that in their billing in terms of working with individuals with diabetes. So that could sort of help eliminate that barrier to taking the time that's really needed to assess for and address social determinants.
And in fact, when you're talking about this, that's one of the things that we do is when we identify that through the USDA, two question, the questionnaire, identifying that food access. And at Yemlish, what we do is we refer them to those resources. But what I'm hearing from you, and which I love, is that payers can actually come together and say, let's identify this and find a sustainable way to close those gaps.
Absolutely. Mm-hmm.
I love that, and that is something happening more on the federal level is to get payers to do that more.
Mm-hmm. Yes, absolutely.
Interesting. Let's switch now gears to talk about diabetes and also obesity, and then what kind of effect does that have? What kind of effect does that have on the well-being of minority families, their children, and then also what suggestions do you have for families struggling with diabetes and sort of this overall burden of obesity? What would you say to them?
So we know that diabetes, it is a very demanding condition for children and their families. And so we know individuals and families where there is diabetes that they could be burdened financially, emotionally, with their mood. There could be distress associated with the day-to-day management of diabetes. There's even things like depressive symptoms. So things like having difficulty sleeping, loss of interest in daily activities for the person with diabetes as well as those who are caring for an individual with diabetes, such as parents. And we know also that it could negatively impact, for example, parents in their work environment because they, could disrupt kind of their things in the employment setting, as well as it can impact the school life of a child, for example, with diabetes. So there are many areas in a person's life that could be affected. And then in terms of suggestions, I think one of the biggest things that could be thought about is that really diabetes is not something that could be managed alone. The burden can really be reduced when the individual with diabetes, as well as their family members, have sufficient support. Searching for and asking healthcare providers about diabetes supports in the community can be something that could be very helpful, or helping individuals think through their support system and how can they expand their support system. I think, probably historically it was thought, that the person with diabetes has to learn to manage it on their own. But with, something as complex and as high demand, as diabetes is, that we know that, building a support system around the individual with diabetes is the way to go.
I want to now touch upon some upstream factors and even policies that impact health. Can you speak to that and help us understand what that looks like today? And then who are the key players in these conversations and what can we really expect from them?
hmm That's a good question. I think, more and more, as we think about the social determinants or those upstream factors that are impacting diabetes management and outcomes, there is a call for healthcare and other social systems to not be siloed kind of in their approach to addressing health, that there really needs to be more collaboration and engagement across both healthcare as well as social sectors. And so I would say, some of the key players, even include things such as sort of the transportation industry, for example, and thinking about, where folks with diabetes live and, is there easy access to the healthcare where folks are receiving their care. That's one way you could think about it. So not all individuals have their own individual reliable transportation to get to medical services. So better planning in communities, helping understand where individuals may be living, communities that have high rates of diabetes, and thinking about where are they seeking health care and making sure that there is transportation access is one thing I think about. The other thing is kind of like what I mentioned with regard to, there could be greater collaboration among payers. So thinking about, we know that there, particularly food insecurity is something, also transportation is something that payers could be involved in, and thinking about, are there partnerships? Are there partnerships with, being very creative, things like Uber or Lyft to help patients get to their medical appointments? Could there be collaborations with businesses, like we mentioned, with healthy groceries? Could there be better partnerships there so that we know if food insecurity is something that's impacting an individual with diabetes, they could actually use their insurance coverage to access healthy groceries? Similarly, from a business perspective, you could think of even exercise and physical activity options. Could payers be more involved in helping an individual with diabetes access exercise programs that are generally, maybe they may not be easily affordable for an individual. So I think, there are these opportunities to work across programs and in the business sector, in the transportation industry, in the food industry to better address a chronic condition like diabetes.
Anything else as far as public insurance is concerned? So you've got the
Hmm.
Medicare, Medicaids of the world.
Hmm.
What can be done there?
So that's what like I was saying earlier. I think better insurance coverage, so that or better options for providers to be able to bill for addressing the complexity of social determinants of health would be something, because when you think about it, providers may be spending more time with those patients. So, being able to bill insurance companies for that would be important. And then, it could end up being where there are also other supports needed in the healthcare setting, because there's a question that comes up. Is the physician with their expertise in managing disease, is that really the right person who should be addressing social determinants of health? Are there other types of individuals, more things like lay patient navigators, who could be working within the healthcare system, who would be better resourced to help patients either, link to community resources, or even just bridging that communication between the patient and the provider around how social determinants are impacting their disease management, so that the provider can adjust treatment regimens accordingly. I think that is Medicaid and Medicare being able to really think about that and provide it, incentives or allow providers to be able to deal in that way. I think would be have a tremendous benefit.
I know I would certainly appreciate that if I'm thinking of food access. Of course, with all of my biases, I would say the dietitian, right?
Hmm.
Have
Hmm.
that person when we're talking about food insecurity. Community health workers, I think, have a stronger role to play in this, certainly.
Hmm.
So I think lots of opportunities there, but just waiting for Medicare, Medicaid, sort of CMS to set those standards, going forward, certainly.
Hmm.
That's lovely. So, with that, Dr. Butler, we're toward the end of the episode. How can our listeners connect with you and just really learn more about your work?
So I am actually on Twitter at AM Butler PhD. You can find me there, and you could also find me on LinkedIn at Ashley Butler, and you can follow me there as well.
Sounds great. Well, thank you so much for your time, Dr. Butler. It was an absolute pleasure having you on today's episode.
Thank you.
Thank you for listening to the Yumlish podcast. Make sure to follow us on social media at Yumlish _ on Instagram and Twitter, and at Yumlish on Facebook and LinkedIn for tips about managing your diabetes and other chronic conditions, and to chat and connect with us about your journey and perspective. You can also visit our website, yumlish.com, for more recipes, advice, and to get involved with all of the exciting opportunities Yumlish has to offer. If you like this week's show, make sure to subscribe so you can hear more from us every time we post. Thank you again, and we'll see you next time. Remember, your health always comes first. Stay well.
This episode is part of our series dedicated to National Childhood Obesity Month for the month of September. With this episode and the rest in the series, we hope to increase awareness around childhood obesity and connect you with experts to help you better prevent childhood obesity and support related initiatives.